Hello, and welcome to an evidence-based approach to assessing thyroid disorders, a video produced in conjunction with the UC Davis School of Medicine. In this video, we'll give a quick overview of the evidence-based physical exam, discuss an evidence-based approach to physical diagnosis in hypothyroid disorders, and provide a video of a UC Davis Master Clinical Educator demonstrating high-yield physical exam maneuvers that every UC Davis grad should know, as well as discussing the evidence behind them. Hand washing before and after each physical exam has been well studied and shown to reduce morbidity and mortality in the hospital and the clinical setting. Listed here are some basic tenets for performing a physical exam and assessing different thyroid disorders. And while these provide a useful basis for our general physical exam, today we're going to talk about a different approach. An evidence-based approach to the physical exam begins with a diagnostic question. For example, does this person have chronic anemia? To answer the question, you first estimate a pretest probability, which is essentially your best guess as to how likely you think this patient is to have the pathology in question, based on aspects of their history, presenting symptoms, etc. It's generally expressed as a percentage. Using this as your starting point, you choose an evidence-based physical exam maneuver, which, depending on whether the test is positive or negative, will feed back on your original hypothesis, giving you a new post-test probability, as demonstrated in this figure. For example, if you don't think that your patient is anemic, giving them a pretest probability of 20%, but then you discover conjunctival pallor on exam, that really changes your thinking, giving you a much higher post-test probability. How much a given physical exam maneuver changes your pretest probability depends on the sensitivity and specificity of the test, which in this case is expressed as a function called the likelihood ratio. You can see in the figure how a positive or negative likelihood ratio can affect your pretest probability either a great deal, for example if you have a positive likelihood ratio of 10 or more, or barely at all, for example a likelihood ratio close to 1. Let's take a look at an example. So let's begin by discussing hypothyroidism. So we start with our pretest probability, which is our best guess as to whether or not this patient has a hypothyroid disorder, estimated based on aspects of their history, their age, their sex, their past medical history, any history of autoimmune diseases in themselves or their family members, and then we choose an examination maneuver to change that pretest probability, move it one way or the other. And I want to point out that there's a couple physical exam maneuvers that you can do before you even really get into the exam that are pretty effective, one being bradycardia, a heart rate less than 60, which, if present, has a positive likelihood ratio of 4.2 for hypothyroidism, and the presence of hypothyroid speech, which is a slow, kind of muffled speech pattern that we'll see an example of right now.
अच्छा की तकलीफ की है थानू
तकलीफ ये है कि मुझे तो 2-3 दिन तो ज्यादा हो रही थी पता नहीं थकावट करके हो रही जिदा मैं तो भारी समान नहीं चक सकती ते आज हट पैर है ना ये बड़ी जल्दी दर्द होने पे हम 2-3 दिन तो
अच्छा ते ਜਿਹੜੀ थोड़ी आवाज थोड़ी स्लो हो गई है ये कदों तो हो गई है
ये आवाज तो मेरी हुई है कोई कहता शुरू तो ही है तो कोई कहता उदा ही करके हो रही हूँ तो आ 2-3 दिन तो
I actually really enjoy looking at that clip, which is in another language that I don't speak, because it really makes you focus on sort of the cadence and the articulation rather than the actual words that they're saying. And so if they have that kind of speech pattern, again, slow, muffled, maybe some extra word searching, then that has a positive likelihood ratio of 5.4. Now notice that both bradycardia and hypothyroid speech, their negative likelihood ratio is 0.7, which isn't particularly strong, as we'll see later. Meaning that if they don't have those things, it doesn't do a good job of ruling out hypothyroidism. Let's talk about our next physical exam sign now, which is delayed deep tendon reflexes, something we're all taught is associated with hypothyroidism. It turns out that the studies have shown that the best deep tendon reflex to test here is the Achilles reflex, which you can test by having the patient lie down prone on the table and looking for both a delayed activation and relaxation phase. With the relaxation phase, even more delayed. Let's take a look here. Note the patient's prone, delayed activation, and even more delayed relaxation phase of the Achilles reflex. One more time.
Next, let's look at a more subtle example using the patellar and brachioradialis reflexes. Notice the asymmetric delayed reflex with an especially prolonged relaxation phase. You can see highlighted in yellow
a couple more physical exam findings that have strong positive likelihood ratios for predicting hypothyroidism. Here to take us through a general approach to the thyroid exam is UC Davis Master Clinical Educator, Dr. Mark Henderson.
So when we examine the thyroid, we do so from behind the patient. So that can be approached in a number of ways. So you usually want the patient sitting, and we like to give them a glass of water because we're going to ask them to swallow, and they may have dry mouth. So when I approach the thyroid, I feel for the largest and firm landmark, which is the thyroid cartilage. You can feel that on yourself, which is where your Adam's apple is. I start with that, which is right here. I can feel the prominence here. This is the top of the thyroid cartilage. Then I usually bring my fingers down. I follow the thyroid cartilage down to the next little bump. There's a little valley and then a bump. That next bump is the cricoid cartilage. Again, it's a firm, almost like it's a very much a smaller, like a half a ring, the cricoid cartilage. So that's here. So we've got the thyroid cartilage, follow it down, and the cricoid cartilage. And so between those two cartilages, there's a squishy membrane right here. It's the cricothyroid membrane. So this is where you would perform like an emergent tracheostomy, right? That's where you would insert the trach. So right below, so that's where I put my fingers. I slide down, to the cricoid cartilage, and then I'm going to have the patient put water in their mouth and then have them swallow, because under the cricoid cartilage is the thyroid gland. So swallow for me. Yeah, so excellent. Maybe take one more drink. I'm going to try again. So I'm feeling the thyroid go under my finger as he swallows. So one more time, David. Yeah, so right here, again, the thyroid comes up and under my fingers, and I feel the contour of it as it crosses my fingers.
So we've now seen a number of physical exam maneuvers that have strong positive likelihood ratios for ruling in hypothyroidism. However, you may notice that there are not a lot of exam maneuvers that have good negative likelihood ratios, and that's where I bring up some of the combination tests at the bottom of the page. The first example is the Bilowix Diagnostic Index, which is a collection of signs and symptoms originally put together in 1969. Note that it has a positive likelihood ratio of over 18 and a negative likelihood ratio of 0.1, making it useful in both ruling in and ruling out hypothyroidism. I wanted to show you a newer scale, though, called the Zalewski scale, which was introduced in 1997, and one large study found to be about 20% more sensitive than the Bilowix scale for picking up hypothyroidism. Here it is, and you'll note that it's a much more simple and rudimentary tool than the Bilowix scoring system, but was found to be just as good at picking up hypothyroidism, and actually picked up about 20% more hypothyroid patients as confirmed on laboratory testing than the Bilowix scale did in that study. So let's take a look at how some of these likelihood ratios play out using the McGee evidence-based physical diagnosis calculator. So we pick hypothyroidism from our drop-down menu here, and we choose a pretest probability, again, how sure we are that our patient has hypothyroidism. It gives us a range that's most common. Let's say that we're, a little bit certain, 30%, and we check the deep tendon reflexes and we get a positive here. Remember, that positive likelihood ratio was just over 3, so we move our needle up there, and we see now our post-test probability is closer to 60%. It's nearly doubled our initial guess as to whether or not this patient has hypothyroidism. Now let's look at another one, bradycardia, positive likelihood ratio 4.2. Again, just about the same. Goes from 30% to 60% certain. And cool and dry skin, positive likelihood ratio of 4.7, even higher. Now we're getting up near 70% for our post-test probability. Remember I said that negative likelihood ratios are not that good. So if they don't have delayed deep tendon reflexes, remember the negative likelihood ratio is 0.6. So we move down here, and we see that our probability goes from 30% to about 23% or so. Not a big difference. So a negative finding there doesn't really help us that much. And that's what I mean when I say the negative likelihood ratios are not great for some of these physical exam maneuvers. They're way better for ruling in hypothyroidism than ruling it out. Now let's take a look at the Biliewicz scale. A positive Biliewicz is a positive likelihood ratio of 18.8. That is virtually a slam dunk for diagnosing hypothyroidism. It's a really good scale. It's been well studied, and look at how it can really dramatically change our thinking. And if we have a negative result, the negative likelihood ratio is 0.1. It essentially eliminates hypothyroidism from our differential. 30% sure to about 4% sure. Here's a figure that just talks about some of those scores here. You can see the Biliewicz positive is greater than 30. Negative is less than negative 15 points. And all these other physical exam maneuvers that we've discussed. In conclusion, I'd like to review 4 take-home pearls from this video. The first is that when you're evaluating a patient with any suspected thyroid pathology, the exam really starts with an examination of the vitals and the patient's general appearance. When you're examining a patient who may be hypothyroid, this includes looking at their pulse, checking the texture and temperature of their skin, and examining their speech. Second, it's key to learn how to do a thorough examination of the thyroid gland, noting both position, size, texture, any notable landmarks, nodules, etc. Third, a good neurologic exam is an important part of the evaluation of any patient with a suspected thyroid disorder. In the case of suspected hypothyroidism, a careful assessment of the patient's deep tendon reflexes, specifically the Achilles reflex, looking for an asymmetric delay in the activation and relaxation phase of that reflex is an important part of the exam. Finally, keep in mind that there are scoring systems such as the Zalewski and the Biliewicz scores that you can use to help rule in or rule out hypothyroidism in the hospital or in your clinic. Thanks for listening.